Madam Speaker, I yield 3 minutes to the gentleman from Texas, Dr. Burgess.
The gentleman from Texas is recognized for 3 minutes.
And I thank the gentlelady from Indiana for the recognition, and I wanted to rise in support of a bill that includes coverage for immunosuppressive drugs after kidney transplant. It's something we've worked on for a decade, but more importantly, for kidney patients and their families, this has been a priority for much, much longer. Today's bill is monumental in the life of the transplant patient. In 1972, Congress voted to allow Medicare coverage for end-stage renal disease patients under 65 years of age. The policy opened the doors for patients to have Medicare pay for dialysis and kidney transplants. But it wasn't quite enough. You know, a new kidney gives the hope of a better quality of life to patients, but only if they take those immunosuppressive drugs. Otherwise, their own immune system is going to recognize the renal graft as a foreign object and reject it, but that's their new kidney. So without these drugs, patients risk rejection of a kidney and a return to dialysis. Now, Medicare, to be sure, will pay for that return to dialysis and another renal transplant if they're lucky enough to get one, but it will not pay more than 36 months of immunosuppressive drug coverage. This is terribly expensive for the Medicare system, but think of the toll on the lives of kidney patients and their families. So the bill before us today will address the immunosuppressive drug directly by requiring Medicare to cover these drugs past 36 months for kidney patients who do not obtain other health coverage. Look, a kidney transplant is a gift from one human to another. From the government's perspective, the transaction is an investment that allows the government to make that investment into a patient's future, and this policy allows us to protect that investment. So it's a policy that's good for the patient, to be sure. As a side benefit, it's a benefit to the taxpayer. Both the CMS Office of the Actuary and the Office of the Assistant Secretary for Planning and Evaluation at HHS have published reports on the benefits of extending Medicare coverage of immunosuppressive drugs, which include financial savings for the Medicare program. So after years, literally a decade of wrestling with the policy, a light finally shone over at the Congressional Budget Office, and they confirmed what others have known all along, that this delivers savings to Medicare. The policy also aligns and builds on what the Trump administration had done with the kidney health initiatives, including the Advancing American Kidney Health Executive Order, which the President signed in July of 2019. So this immunosuppressive drug policy has support from everyone, from the patients to transplant surgeons to patients' families, and it's something behind which the Kidney Coalition has coalesced for years. We would not be here today if it wasn't for the tireless work of that community. An additional 30 seconds. The tireless work of the kidney community and other co-sponsors, and I want to thank all of the many people, including the staffers on both of our committees who've worked over the past decade, tuned and fine-tuned this policy to get it where it is today. I thank the gentlelady for yielding, and I yield back the time.
Gentleman yields back his time. The gentleman from